The eye exam. Following appropriate hand hygiene and introduction to the patient, the exam begins with an inspection of the eye. The sclera and conjunctiva are examined for any discoloration or jaundice, and the diameters of the pupils is assessed. Any discharge or abnormality is noted. Next, we test visual acuity using a Rosenbaum chart. Holding the chart 14 inches in front of the patient covers one eye and reads the lowest line of text they can.
426739.
Then the opposite eye is covered and the same line is read backwards.
937624.
And finally, we test acuity with both eyes open.
426739.
Next, we test for visual field defect using the fishbowl test. Standing in front of the patient, the provider places their hands about 2 feet apart either side of the patient's head. Moving their hands forward with fingers wriggling, the patient acknowledges when they can see the moving fingers.
No. No. No.
Now we assess the near reaction. The patient is asked to look at a point across the room, and the provider then puts an object in front of the patient, asking them to switch their gaze to the object. The provider watches the eyes and notes constriction, convergence, and accommodation. Holding a pen at arm's length in front of the patient, the provider assesses convergence by moving the pen towards the patient's nose. Next, we assess extraocular muscles and the associated nerves. Standing in front of the patient and holding the pen at eye level, the provider moves the pen to the right, assessing the medial rectus, up to assess the inferior oblique, down for the superior oblique, back across to the opposite side, pausing to check for nystagmus, up to check the superior rectus, down to test the inferior rectus, and back to the lateral rectus. And that was assessing the left eye. Now we dim the lights to assess the corneal light reflex. Shining a light so that it's in both eyes, the reflection is noted. It should be symmetrical in both eyes. For the next test, we're going to test the pupillary constriction response. Both direct and consensual response is tested in both eyes. Now we will conduct the fundoscopic exam. First, the ophthalmoscope is checked to make sure the correct lens is selected. With the ophthalmoscope in the provider's right hand, the patient's right eye will be examined first. Moving in toward the patient at a 15-degree angle, the red reflex is noted, and then the vessels of the eye are traced toward the center until the disc is visible. The color and clarity of the disc is observed. The size of the cup in the center of the disc is noted, and the vessels of the eye are assessed. It may also be possible to see the macula. And this concludes the eye exam.